So, my name's May Sue. I'm a GP working at Cremorne Medical Practice. Excuse me.
The practice, no worries.
I know. So I'm a GP working at Cremorne Medical Practice, which is one of the medical practices across the road. I also have a master. My background is I have a master's in mental health, and I teach at the New South Wales Institute of Psychiatry, and I'm a college examiner, and I'm very passionate about postnatal depression and improving awareness, and it's something that we recognise that we see a lot in the community, but that there aren't as many resources and awareness of how to actually manage it. So this is why we've actually been so keen on doing this event. And I'm also a mum, so that's who I am. So who here, I presume, have babies or about to have babies? About to. Who here feels that they kind of get parenthood and they know what to do about it? So I guess that's why you're actually here today. And I think the answer is that nobody really understands what parenthood is about. And even the experts don't really know what it's all about. What we actually think we know is called early childhood developmental theory. And it's been more of a focus in the last 40 or 50 years. But we're still really trying to work out what it actually means in terms of how we raise our children and what it means from a practical sense. So every family is different, even every child within every family is different, and there might be different cultural practices, there might be personality factors of the child or the parent or the grandparent, and there might be other factors, even just what position that your child holds in the family, if there's been any illness in the family, if there's been a relocation, what sort of supports are available, all make a difference as to how this experience of parenthood is going to be for you. So what do we actually think that we know? So we describe what we know about parenting as early childhood education theories. And theories are concepts which are based over time from research and thinkers such as, when we get the picture up, who will magically appear over there. So the main sort of childhood education theories that we use are based on how an infant bonds, how an infant thinks about things, their physical development, social development, and how they play. We have thinkers like who's up here, Bowlby, Vygotsky, Chomsky, Gesell, Piaget, who are all just going to be people who I'll describe just as we go along. So just talking about how an infant bonds. In the 1920s, there were a couple of well-known theorists who thought about this a lot. Erik Erikson was apparently a blonde, blue-eyed man growing up in a Jewish family, and he thought a lot about what it meant to grow up in a family like that, and he described 8 main theories from childhood to adulthood, and what those stages were typical among lots of different people. And then we have John Bowlby, who he describes having had his father die from a very early age and have an uninterested mother, and he thought a lot about what it meant to have a good bond with a caregiver. So he described what we call attachment figure, which actually describes what the bond is between a parent and a child, but it can actually describe any caregiver and a child. So you can have primary attachment, which is between your main caregivers, and you can have other attachment figures, which are other important people in your life. And his, And his theories were further described by a lady called Mary Ainsworth, who actually then talked about security of attachment and what that actually means in terms of the importance of that and the relevance of it. So a secure attachment is caused by the carer and the infant actually responding appropriately to each other. They're picking out whether, a carer picking out whether the infant actually wants to actually have interaction, and there are some times where the infant might actually respond by turning the gaze away or not being interested, and the carer responding appropriately to actually then giving them some time away as well. So it's a give and take. It's not always about focusing and trying to develop them. Sometimes there will be times where they actually do need some space as well, and times where they do need some engagement and they do want some involvement. So that's what a secure attachment is. And what we actually recognise is that security of attachment actually affects the infant's emotional development, not just at that time, but also in the future. It helps good cognitive, language and social development as well. So then we talk about how an infant thinks. Leo Vygotsky, who was a Russian theorist in the 1920s, he talked about, 1930s, he talked about the zone of proximal development, which is mostly focused on how infants learn in a social and a language context. And what he actually described is that infants, the caregiver can help to promote good learning by encouraging the infant to learn within their comfort levels. So they develop skills which is closest to what they already know, and then as they develop and they learn those skills, they expand on those actually further. So building up bit by bit, so that each new cognitive step isn't too much a hurdle for them. Then we have Piaget in the 1960s, who described 4 main cognitive theories. Piaget actually was a fellow in Switzerland who worked with Binet. Binet wrote a lot of intelligence tests, and Piaget was involved in marking all of those intelligence tests for lots of children, and he worked out that there were lots of things which came up which were consistently wrong in different age groups. And so he actually worked out that there were big developmental jumps which occurred for most children, a range of children within those spectrums. So I guess what we think about in the 0 to 2 year old range is he describes the sensoromotor, is what he describes the sensoromotor stage, which is from 0 to 2 months old, where infants really learn based on their 5 senses, and they're very egocentric, which means that they're not really viewing the world from other people's viewpoint. If your baby's crying, they're not doing it to upset you, they're just trying to actually get their needs across, and they're really just trying to perceive the world only from their own viewpoint. They're not actually capable of viewing it any further than that at that very young stage. He describes from, and I might talk about this maybe just a little bit later, just going into that in detail. Then we talk about how that infant learns to speak. So Noah Chomsky talked about how there are intrinsic factors, so just some genetic factors which allow language development from a very early stage, and just to show that there are some actual real, in terms of from the very early years, there are some very intrinsic factors which allow them to actually develop language, and why it's so important for us to actually talk to our children and communicate with them early, because that's when they're actually laying down the groundwork for them actually being able to talk and being able to comprehend what they're talking about. Then we talk about some of the behavioural sort of theories like Bandura, who talked about cause and effect. So, for instance, if they try to articulate a word and you give them positive reinforcement for that, they'll try to articulate that again. For instance, and they usually do soak things up anyway, but if you give them less reinforcement, they may be less inclined to follow that as well. Physical development was discussed by Arnold Gemsel in the 1920s, and he drew up a big timetable of events, which we'll kind of have a look at later, which is where most children have a range of different physical abilities that they're able to do. And then we talk about social development and social play, which is, I think, what the focus of what we're going to be talking about today. So Erickson, Bowlby, Ainsworth, Vygotsky, Bandura, they all talked about their concepts of learning within a social environment. And what we recognise is play is actually really important for learning. It promotes both mental and social abilities in your child. And when we're just playing with our kids, they're actually soaking up a lot of stuff just by us interacting with them. So Bronfenbrenner described this sort of system that we have here, which is kind of just the environmental role of how relationships shape how our kids learn about things. So we think about the microcosm, which is actually just the family interactions within a child, like the important sort of links that a child has. So we talk about that's with their family, that's talking about like if they're going to a childcare, the relationship they have with their childcare educators or with grandparents. Then we talk about the mesosystem, which is actually the interactions that their primary caregivers have with other important figures in their life. So, for example, what's the interactions that their parents have with their childcare educators? We talk about the exosystem, which are things that the infant actually can't actually control. So, for instance, it might be that they're actually part of. So, for instance, something like the father's job might influence what they may have access to, whether the father has to travel away a lot, or whether they may have access to resources they might not otherwise have, or don't have access to things that they might not have. That's what we talk about, the exosystem. And then we talk about the macrosystem, which is actually the bigger cultural group of where they live. And what we actually realise is that all these factors are really important in shaping kind of how our kids develop and what happens with them. So Piaget, who I mentioned before, where he talked about the sensoromotor stage, and Sarah Smolowski talked about how infants explore objects and their environment. And he actually described that in terms of different stages, just being aware that like 0 to 4 weeks of age, which is where I think some of the small pups are, they actually can't really do all that much. All they can actually do is really just habitual sort of movements and reflexes. So they root, they suck, they're not really aware of very much else at about 4 weeks of age. As they get a little bit older, they're a little bit more aware of what they can do. So they learn to coordinate sensations and they learn to try to replicate what they kind of do. So you might notice, for instance, they suck their thumb reflexively and then they feel that the sensation's interesting and then they try to do it again. So you might notice some more exploration, but it's only just what we call this functional play. So it's just around their own body at this stage. They're not really able to explore other objects. They're not really able to perceive much else outside of what's going on with them until they're a little bit older. Then we talk about constructor play, which is where they actually start to interact more with objects. So it might be that they might be able to reach out and touch things and play with things and notice the feel of that. Or you might notice that a lot of it's actually around what's happening in their mouth, and this is probably from about 4 to 8 months of age, everything goes in the mouth. So this might be where they become more aware of things which are outside of their body, the object orientated. And then from 8 to 12 months old, they try to actually reach a goal with some of those things as well. So that's where they're doing more of the constructive play, which then becomes the dramatic play, which is where they actually try to tell a story with some of those things that they're actually playing on. So just being aware that there are very distinct developmental stages where some of those processes occur, and we can't really speed up some of those processes. They occur when the next kind of developmental leap actually occurs in your child. We then talk about how children actually interact with other people, so whether they actually play kind of unoccupied, so they play just in their own sort of internal world when they're really little, playing by themselves, so not interacting at all with other people. Parallel play describes where you have infants who are, it's probably more like early toddlers, where they're playing with the same sort of objects as another child next to them, but they're not actually engaging with them. It's actually a very long time until they start doing group play. You're probably talking more of preschooler, which means all of those play groups, which you feel you have to go to, and you kind of feel like if I don't go to that, I'm going to really stunt my child's development. It's probably more for you. And so just be aware that your child's not necessarily going to be, they'll be fun, it'll be good, but they're not necessarily going to be running around with other children and playing with them in the way that we think of children as playing with things until they're probably a bit older. But I think it's still important that you guys go out and do things for yourself as well. So. So I was mentioning how I'd talk a little bit more about what the kind of physical developmental things are. So we talk about things in terms of milestones, and milestones are the skills we expect babies to have developed by a certain age. So smiling, rolling over, crawling, waving. Some babies skip certain milestones, which is actually completely fine. So a good example of that, for example, is if there's a child learning how to walk and they don't actually do the whole crawling stage before they walk. They might actually just be sitting and then just start walking without doing that in between phase. As long as they get there in the end, that's what's important. It doesn't have to be that they reach every single milestone. And they're a really rough guy. So there's a very big variation between children as to when they reach certain milestones, and you may find that a lot of that is dictated by the child's interest. So some children may actually be early developers in some forms of milestones, whereas not as developed in others. And even among family, there might actually be a very wide variation as well. So we categorise milestones as gross motor, which is where you talk about these large sort of movements of the limbs, and we talk about fine motor, which is kind of smaller movements, including the hand sort of movements and pincer sort of grip. Social skills, which is the interactions with others. It's even just something as simple as actually meeting your gaze and smiling. And language skills, which is comprehending language and then being able to speak with it. Multilingual children actually appear slower in terms of language development, but they catch up in the end. In fact, there's lots of other advantages for having more than one language. Just out of interest as well, apparently language development before the age of 7 is a totally different way of learning than children who are over 7 years old. So if you want your child to be multilingual, better to do it before they're 7 years of age. So these are just the examples of 0 to 3 month olds, which I think is probably going to be the age group which I think most of you are going to be interested in at the moment. So the good news for you guys, for tired and new parents, is that they don't actually need all that much interaction at a very early age. Just looking at you and listening to you is probably going to be really important for them. And all the other stuff, as I mentioned, they might not actually be at a stage for them to really appreciate until they're a little bit older at all. So mostly it's going to be things just like eye contact and gazing. That's actually play as well, and that's actually really important for their development. You can chat to your baby, and we encourage talking to your baby for language skills, even from as early a stage as possible. You can actually read to your baby from any age, but usually just really simple sort of books, or at this sort of age it might even be black and white contrasty sort of things because they can't really read words. You might find that you really start to get more out of your reading when they're probably over about 3 months of age, but by all means it's really good to start from a very early age. When your baby's had enough, as I mentioned, they'll actually start to look away and show you some tired signs that they're not really wanting to engage anymore with that play. With kind of toys that they might actually use, I think I showed you, there might be just something like a simple sort of rattle that you might have in front of them. Or, as I mentioned, you might just do some contrasty sort of shapes or colours. We're probably about 20 to 30 centimetres away from them. They can't actually see very far at this stage, so you might find if it's much further, they're probably not really going to be able to see much at all other than maybe bright lights in the far distance. At 3 to 6 months of age, they can probably do a little bit more, which is nice. They can actually roll over, they can grasp objects, they can sit up with stuff, so the kind of things that they might start grasping. So they can start grasping things like rings as well, and they might start putting all of that in their mouth. Tummy time probably gets a little bit easier to do as well, and you've probably all heard about tummy time, but be aware that there are other movements that you can actually have your baby in. You can actually have them just lying in their side, which is a really good transition sort of movement into rolling as well, and it just gives them a break from tummy time. And you can make tummy time a little bit of fun as well. You can try lying onto your chest, or you can try lying them in different sort of positions, so it's not all the same thing every time. Probably in terms of amounts, so probably 10 minutes for every month of age. So by about 4 months, it's probably about 40 minutes in a day, but you break that up as to how you're actually going to do it. So you'll find at this point, you can probably also try getting things like a mirror, and they can try looking at themselves in the mirror. And they'll probably still enjoy the rattles and squeaking noises as they're hearing, they're listening to those things. And you can start playing things like peekaboo with your child at that age as well. About 6 to 9 months. So 6 to 9 months, they can actually usually sit up unaided at this point, and some babies might actually start crawling. You might actually find something like this quite good for babies who are crawling, because they kind of roll after it on the ground, and it can kind of encourage them to actually go a bit of a fair distance. You might find they might start holding blocks, but they might not really do very much with them at this sort of age. But again, just simple sort of objects for them to touch and hold might be interesting for them to do. And just kind of books with different textures in them. So you may find that some books have kind of shiny sort of textures or things for them to touch, which might actually be kind of fun for them at this age as well, as they're exploring those parts of touch and sensation and hearing, which they're becoming more aware about. Tupperware containers, wooden spoons, pots and pans. Toys don't have to be expensive, they can just be things around the house if you want. And this might be a good time to start thinking about home safety as well, because they probably will get into a lot of things that you're not expecting them to get into. So maybe just making a cupboard or drawer that's safe for them to pull apart and chew on would be okay. At this stage, they're probably also doing things like finger food, so that can also be fun for them as well. In fact, everything's usually going into their mouth at this stage as well. So 9 to 12 months of age. So usually they're mobile at this stage, so they're crawling. Some babies are starting to cruise or even walk at this stage, and a few babies don't really crawl, they just kind of bottom shuffle along until they get to walking. They start vocalising, so this might be where you start hearing them doing their little sort of chats. It might not necessarily be articulate, but some children might actually speak 1 or 2 words, but they might actually comprehend a lot more than you think. They might have fun. These sort of cups are great because they actually, with water, they start tipping them out at this sort of phase and seeing them go into different sort of objects. So they're really good fun sort of bath time things. And this is probably where you're going to get a little bit more interest with actually starting to stack their blocks up as well. But you probably want actually quite large blocks that they can hold, because they're not going to have the fine motor control to necessarily hold up smaller blocks at this age as well. Or you can do things like shape sorting and stuff as well at these ages, or just some simple sort of ball throwing at this phase as well. You can also play games with them with a little bit more interaction, like pat a cake or this little piggy. And I think you can see those sort of pop-up things. They might need a little bit of help with some of those things, but at least they can start to get interested in them. So what do you do if you're concerned about your baby's development? Seek help. 9 out of 10 times it'll be fine and you can get reassurance, but if there are any concerns, it's good for us to look into these things early. People that you can talk to, the early childhood centre like here, or you can speak to your GP or to your paediatrician as well if there's any concerns. So just, I guess, to summarise kind of what we were talking about, there's lots of different ways of thinking about how babies learn and how families function, because every family, as I said, will have different ways of interacting with their child. Early childhood development is based on the secure, consistent bond with the caregiver or caregivers, a supportive, nurturing and fun-filled social environment, what behavioural cues that they get, what developmental stage that they're at, freedom to learn within a safe environment with consistent, simple, easy to understand boundaries. So it has to be, their boundaries have to be targeted to what age group that they're at, but they also do need some freedom to actually learn and develop some of those skills themselves. And it can be really hard to sit back and watch your child try to reach for a toy, but sometimes it's good just to give them those opportunities to try doing it all themselves as well. And there's no prescribed play routine for every infant. Normal is a very wide range and continuum. Some children may have a more physical interest and they might develop early from that perspective, and others might be more interested in language skills. There's no right or wrong about this, and anyone who tries to compare or tell you what milestones, it's not one size fits all. It's more really about learning how to engage and interact with your infant from even a really early stage, and they can have even just those eye gaze moments can be a very early interaction you have from the very start, and it can be rewarding, it can be challenging, it can be exciting. Every time you think you know what's going on, it changes again. So listen, play and just have fun.